Understanding the menstrual cycle, how to maintain a healthy period. The menstrual cycle is a natural and essential process that helps prepare the body for a possible pregnancy each month and understanding how to care for your body throughout this cycle can make periods healthier, more predictable, and more comfortable. A typical cycle is often around 28 days, but anything from 21 to 35 days can still be perfectly normal because every person's body is unique and influenced by age, lifestyle, and overall health. The cycle moves through four broad phases. The first is the menstrual phase, when the uterine lining sheds and bleeding occurs. Next comes the follicular phase, when the pituitary gland in the brain releases follicle-stimulating hormone, encouraging the ovaries to prepare an egg and the uterine lining to thicken again. Around the midpoint, ovulation occurs, releasing a mature egg, and finally the luteal phase begins, during which progesterone levels rise to either support an early pregnancy or, if no fertilization happens, signal the body to start the cycle anew. Keeping this rhythm on track depends on many everyday factors: nutrition, activity, stress management, sleep quality, and attention to hygiene, and caring for each of these areas can make a noticeable difference. Nutrition plays a foundational role in supporting hormone balance and energy levels throughout the month. Iron is particularly important because blood loss can deplete iron stores. Foods like lentils, black beans, chickpeas, leafy greens such as spinach and kale, lean red meat, and iron-fortified cereals can help replenish what is lost. Pairing plant-based iron sources with foods high in vitamin C, such as citrus fruit or bell peppers, enhances absorption. Omega-3 fatty acids found in salmon, sardines, walnuts, and chia seeds have anti-inflammatory properties that may help reduce cramps and support heart and brain health. A rainbow of fruits and vegetables delivers antioxidants like vitamins C and E, which help reduce cellular stress and support the immune system. Complex carbohydrates from whole grains, sweet potatoes, and brown rice keep blood sugar steady, reducing the mood swings and energy crashes, sometimes associated with premenstrual syndrome, while adequate protein from eggs, tofu, poultry, or legume supplies the amino acids needed for hormone production and tissue repair. Calcium and magnesium, available in dairy products, fortified plant milks, nuts, and seeds, can also help ease muscle tension and cramping. Hydration is equally important. Drinking enough water, about 2 liters a day for most people, can help reduce bloating, ease fatigue, and support healthy blood flow. Herbal teas such as ginger or chamomile may soothe mild cramps and provide warmth and relaxation. Regular physical activity supports a healthy menstrual cycle by improving circulation, balancing hormones, and reducing stress. Light to moderate exercise, brisk walking, cycling, swimming, yoga, or Pilates has been shown to ease cramps and improve mood by releasing endorphins. Strength training 2 to 3 times a week helps maintain bone density, which is especially important because estrogen plays a role in bone health. High-intensity workouts are fine if you feel up to them, but it's important to listen to your body. Some people prefer gentler activities during the first days of bleeding and then return to more vigorous exercise later in the cycle when energy naturally rises around ovulation. The key is consistency and tuning in to how you feel rather than forcing a specific routine. Managing discomfort is another practical part of menstrual care. Many people experience cramping caused by uterine muscle contractions. Applying a warm compress or using a heating pad on the lower abdomen can relax these muscles and reduce pain. Gentle stretching or restorative yoga poses like child S-pose or reclining bound angle pose may provide additional relief. Over-the-counter medications such as ibuprofen or naproxen can be effective when used as directed and when no medical contraindications exist. But it's always best to check with a healthcare provider if you have questions about dosage or safety. Keeping a menstrual diary or using a cycle tracking app helps you anticipate when cramps, mood changes, or other symptoms might appear, so you can plan self-care in advance. Good hygiene during menstruation is essential for comfort and to reduce the risk of infection. Whether you prefer pads, tampons, menstrual cups, or period underwear, the important thing is regular changing or cleaning. Pads and tampons should generally be replaced every 4 to 8 hours, depending on flow. Menstrual cups should be emptied and rinsed at least every 8 to 12 hours, as recommended by the manufacturer. Always wash your hands thoroughly before and after changing or emptying any product. For those seeking environmentally friendly options, reusable cloth pads or period underwear can be convenient and cost-effective over time, provided they are washed and dried properly between uses. Stress management is critical because chronic stress raises cortisol, a hormone that can interfere with the delicate signaling between the brain and ovaries, sometimes leading to irregular or missed periods. Incorporating daily relaxation practices, whether that's deep breathing exercises, mindfulness meditation, gentle stretching, or simply spending time outdoors helps lower stress levels and supports hormonal balance. Regular social connection, enjoyable hobbies, or journaling can also provide emotional outlets that ease tension. Sleep is another pillar of menstrual health. The body relies on a consistent circadian rhythm to regulate reproductive hormones. Aim for 7 to 9 hours of quality sleep each night. To promote restful sleep, try to maintain a regular bedtime, limit caffeine intake after early afternoon, and reduce blue light exposure from phones or computers in the hour before bed. Adequate sleep not only improves mood and energy, but also helps keep appetite and metabolism balanced, which indirectly supports a healthy cycle. While some variation in cycle length or flow is normal, certain changes deserve medical attention. Extremely heavy bleeding that requires changing a pad or tampon every hour, periods that stop for more than 3 months without pregnancy, severe pain that interrupts daily activities, or sudden significant shifts in cycle length can all signal conditions such as thyroid disorders, polycystic ovary syndrome, PCOS, endometriosis, or hormonal imbalances. A healthcare provider can perform a pelvic exam, run blood tests, or order imaging to identify and treat underlying issues. Even without concerning symptoms, regular checkups with a primary care physician or gynecologist help ensure overall reproductive health, allow for screenings such as pap tests when appropriate, and provide an opportunity to discuss birth control, family planning, or any menstrual concerns. Maintaining a healthy weight also supports hormonal balance. Both significant underweight and overweight can disrupt the cycle by affecting estrogen levels. If needed, gradual, sustainable changes, such as adding more nutrient-dense foods and engaging in regular physical activity, are more effective and safer than extreme diets or sudden weight loss. It's worth remembering that lifestyle changes take time to influence the cycle. Hormonal shifts and the maturation of ovarian follicles follow a roughly monthly rhythm, so improvements in nutrition, exercise, stress management, or sleep may take 2 or 3 cycles, roughly 2 to 3 months, to show clear results. Consistency is far more important than quick fixes. In addition to physical care, cultivating a positive mindset about menstruation can be empowering. In many cultures, periods have been stigmatized or treated as something to hide, yet they are a normal sign of health and fertility. Viewing your cycle as a vital sign like blood pressure or heart rate can help you notice when your body is signaling that it needs attention. Sharing experiences with trusted friends, family members, or support groups can normalize the conversation and reduce anxiety or shame. Overall, supporting menstrual health is about nurturing your entire body. Eating a balanced diet rich in iron, omega-3s, and colorful produce, staying hydrated, engaging in regular exercise suited to your energy level, managing stress with mindfulness or gentle activity, getting consistent, quality sleep, practicing good hygiene with the menstrual products that work best for you, and seeking medical care when needed all work together to keep the cycle regular and comfortable. These habits benefit not just the reproductive system, but also heart health, bone density, mental well-being, and long-term vitality. By understanding how the cycle works and responding to its needs, you can turn menstruation from a source of monthly stress into a sign of ongoing health and self-care, empowering you to stay in tune with your body and live each month with greater comfort and confidence. If you enjoyed this video and found it helpful, please give it a thumbs up, share it with friends or anyone who might benefit, and subscribe to the channel for more science-based health and wellness tips. Your support helps us keep creating valuable educational content for you.